Recently, I had a local gym reach out to me. They estimated that 40% of their members were leaking during their group fitness classes. They knew that there was something they could do about it, but they just weren't sure what. So we decided that I would host a pelvic floor workshop. Before the workshop, the gym members submitted their questions. So today, we're going to go through the questions because I know some of you may be interested in the answers. If considering childbearing, what are some things I can do now to help while pregnant and post baby? So we'll break that down into while you're pregnant and post baby. So while you're pregnant, getting a physical therapy assessment can be very helpful because if you're going into pregnancy with any aches or pains or weaknesses on one side of your body versus the other, that's something that we want to address before your pregnancy progresses. So any aches and pains that you start out with may get amplified during pregnancy because of the way that your posture will change, the way that your body will change, your weight will increase. So if we can get a good handle on those before pregnancy, it can help you have a smoother pregnancy. We can also work on strengthening your pelvic floor, finding your pelvic floor muscles, because those are the muscles that are going to help support your body and support your baby. And then lastly, during pregnancy, we can help you prep for birth. So a lot of people don't know this, but we can help you learn how to breathe correctly during labor. We can teach you different positions to get into while your labor is progressing. So there's a lot of benefits to coming to physical therapy or meeting with a physical therapist while you are pregnant. You don't even necessarily have to have any aches and pains to come do physical therapy while you're pregnant. We are experts in movement, so we can look at how you move and help you move better to prevent problems in the future. Now we'll talk about the post-baby piece of that. So yes, absolutely things that you can do post-baby to help you recover and get back to your fitness routine. So if you are postpartum, we typically recommend about 6 weeks before you come to see us. We want to make sure everything is healed well and that you've been cleared by your birth provider. So the first thing that we'll look at is your strength of your abdominal muscles and your coordination, your breathing patterns, as well as your pelvic floor function. So these are going to be kind of your building blocks, your foundation to progressing back into exercise and just into life. Obviously, you're going to have to be picking up your baby, which will, your baby's going to keep growing, keep getting bigger. So it's important that you're able to use your muscles to safely lift and to safely live life. So we will work on strengthening all of those muscles. It will work on breathing correctly, how to lift, and if you have any type of like abdominal separation, we can address that. And of course, if you're dealing with any postpartum issues such as urinary leakage or pain with sex, that's some things that we can address as well. Next question we got was, does a strong core mean the less likely the chances of diastasis recti during pregnancy? So diastasis recti, that is the separation of the six-pack muscles, or the muscles that lie on top of your abdomen. They separate a little bit and the connective tissue between them gets stretched thinner during pregnancy. So most of the time after the pregnancy that will resolve, it will heal itself, it will come back to its normal resting position, but sometimes it doesn't. And that's when you're left with something called diastasis recti or diastasis recti. So unfortunately, no, having a strong core by itself is not enough to prevent diastasis recti. It has to do with how big your baby is, how fast your abdomen grows, how you're carrying your baby. There's a lot of different factors that can lead into that. Also, if you're extremely petite and your stomach has to grow, quite a bit to accommodate your baby. But having a strong core during pregnancy can really help you with recovery. So even if you do end up with a diastasis, if you know how to engage those deeper core muscles, you're going to be able to progress through your rehab a lot quicker. So I would definitely recommend keeping a strong core throughout pregnancy, but just know it might not necessarily translate into no problems with abdominal separation. And the last question we got from gym members regarding pregnancy was, how will physical therapy treatment affect my fitness routine during pregnancy? And that is a great question. So these people who were at this gym, they're obviously very active. It's part of their lifestyle to exercise. So they had a lot of questions regarding how to exercise during pregnancy. So one thing that we always like to do is provide modifications. So some of the exercises that you do normally might not feel appropriate while you're pregnant. For example, in your second and third trimester, it might get more uncomfortable to lie on your back to do exercises. So we can talk about ways to modify those exercises to where they're more comfortable and more accommodating of your growing belly. We can also modify exercises that put a lot of strain on your lower back or that cause a lot of pounding and jumping through the pelvic floor. And we can help modify exercises so you can do them a little bit longer to protect that core from separating like we talked about in the previous question. So it will have some effect on your fitness routine, but in a positive way, because we will help guide you through some different modifications so you can continue to be active throughout the course of your pregnancy. So if you're currently pregnant, wanting to become pregnant, or you're postpartum, I hope you found these questions relatable, and I hope that the answers were helpful for you. If you are pregnant or postpartum, please leave me a comment about any other questions that you have regarding pelvic floor physical therapy during pregnancy or just exercise in general during pregnancy and postpartum, and I will do my best to answer. Thanks for watching.